Hey guys. Okay, now that we have finished up with epidemiology and taking a look at what that means and how we approach epidemiology and how epidemiologists are constantly trying to work to eradicate diseases and protect those those that are vulnerable to make sure that they do not get these pathogens. Now, what we're going to take a look at in chapter 12 today, we are going to look at how healthcare facilities are taking care of the same thing, how they approach epidemiology, making sure that we protect those that are in the healthcare setting that are there for one reason. We don't want to make, especially since they're maybe immunocompromised, we don't want them to pick up a pathogen, making them even sicker than they already are. And those that come in with those pathogens, we want to make sure that we isolate them in a way to make sure that their pathogens are contained in a certain area. So let's take a look and see what I mean by that. All right, let's take a look at chapter 12 here. All right, so microbiology within healthcare facilities. So healthcare epidemiology is what chapter 12 is titled here. So we're going to view an introduction as usual. We're going to talk about what I mean by healthcare associated infections. Oftentimes you will see that as HAI, and that's what that stands for. We'll take a look at these hospitals and healthcare facilities and how they maintain infection control. So we'll talk quite a lot about infection control today, and then we'll end chapter 12. Okay, so we already know what epidemiology is. Epidemiology, again, is the study of disease. So healthcare epidemiology is the study of really the same thing, but within a healthcare facility. So it's the study of the occurrence, determinants, and distribution of health and disease within these healthcare facilities. The primary focus of healthcare epidemiology is on infection control. So meaning how, like I talked to you guys about at the very beginning, how do we maintain this? How do we keep our immunocompromised patients protected? And how do we keep those that are really sick isolated? So it's that control, trying to make sure that that doesn't happen, that we're not spreading pathogens all over the place, as well as prevention of these healthcare associated infections. So healthcare epidemiology is going to include any activity designed to first study to see how we do this and then improve these patient care outcomes. So infectious diseases as a whole can really kind of be divided into two categories. And I think this is pretty self-explanatory. One, either those that are acquired within a healthcare facility. So again, we call those healthcare associated infections, meaning that you go into a healthcare facility, say a hospital or a doctor's office, and you pick up a pathogen while you're there. That's a healthcare associated infection. Those that then acquire those outside of these healthcare facilities are called community acquired infections, meaning that you have already picked up the pathogen, maybe from somebody at school or a coworker, and then you go to the hospital because you're sick. So you have picked up a community acquired infection. You didn't get it while you were at the hospital. So that's what we're looking at here is when patients come in for one thing and they're picking up a pathogen while we're there. That's what I mean by a healthcare associated infection. So just to explain to you guys the frequency of these infections, of approximately 40 million hospitalizations per year in the United States, it's estimated that about 2 million of those patients, so about 5%, which doesn't seem like a lot with that, but it's still about 2 million people that are acquiring these healthcare associated infections, meaning that maybe they've come in for chemotherapy. Again, immune system's pretty weak in that situation. So maybe they came in to have that treatment and then they leave with an infection, or not leave, they're there even longer because they've picked up an infection. Burn victims, they are open to infection because their skin, which is their number one protective layer on their body, is now very vulnerable. So people that are really, really sick oftentimes, are immunocompromised and sometimes pick up another infection. Patients who have to be catheterized, sometimes those catheters can, by having to insert them, sometimes they have, pathogens on them and can then develop UTIs. So things of that nature, that they come in for one thing and then they pick up another. So about 2 million people are that's what they're going through. And the idea of healthcare epidemiology is to limit that and to make sure that number goes down. So what are the four most common types of HAIs? In descending order, I just mentioned UTIs. Like I said, a lot of times because we have patients that have to receive catheters, oftentimes urinary tract infections are the result of that. Any type of invasive procedure where we have to enter a patient's body can sometimes be, we want to make sure we're really careful with that because of the fact that there are indigenous microflora everywhere that sometimes then when entering into a different part of the body can then become opportunistic infection or opportunistic pathogens. Surgical site infections, so also referred to as post-surgical wound infections. Again, I mentioned that the skin is our first layer of defense when it comes to our immune system. So because of that, if it's ever open, like in a wound, like that somebody who has had to recently go through surgery, sometimes they are open to infection. Lower respiratory infection, so commonly pneumonia is something that can sometimes occur in a healthcare facility. Bloodstream infections. If you remember when we talked about, and actually, I don't think we've talked about this yet. This is something we'll talk a little bit more about too. Septicemia is a very common bloodstream infection where bacteria can get into the bloodstream. If you remember, we talked about indigenous microflora on the skin. In the event that a needle is put into a skin for a blood draw, if that is not sterilized correctly, sometimes that indigenous microflora makes its way into the bloodstream, and that's not where it belongs, and then can sometimes then lead to infections. So other types of common HAIs would be gastrointestinal disease caused by C. diff. That's maybe a common one you guys have heard of. And there are others, but these are your most common ones. Okay. So who are our patients that are more likely to develop these HAIs, these healthcare associated infections? Elderly patients. Elderly, their immune system is weakening as they get older. So oftentimes that makes them more susceptible. Women in labor and delivery, same thing. Immune system is weakened in that situation in their lives. Premature infants and newborns, again, their immune system has not had a chance to develop, so they're definitely vulnerable. Surgical and burn patients, again, because their skin is now open, there is just, it's again, pretty much just saying anything that makes its way into this person's body is going to, or around this person's body may make its way in. Diabetic and cancer patients, also immunocompromised. Patients receiving treatment with steroids, anti-cancer drugs, anti-lymphocyte serum, and radiation. Any type of immunosuppressed patients and patients that are paralyzed or undergoing renal dialysis or catheterization, again, because of the invasive nature of those situations. So all of these individuals are the ones that are more susceptible to these types of infections. So these are ones that we definitely want to make sure we're protecting, but really in all situations, we want to make sure we're always maintaining infection control. And we'll talk about that as we continue through this chapter. So some major factors that contribute to these healthcare associated infections. An ever increasing number of drug-resistant pathogens. You know, we've talked about drug resistance and superbugs and how sometimes they develop mutations and things of that nature that can sometimes make them be able to hide from our immune system or hide from medications, and then again causing them to be kind of even scarier. So there's these, you know, those drug resistant pathogens, we're seeing more and more of those occur. The failure of these healthcare personnel to follow infection control guidelines. And we'll talk about this in just a minute. We'll talk about how sometimes why that happens. So if they're not maintaining or following those guidelines, that can sometimes lead to, you know, lapse in taking care of these patients and sometimes giving them pathogens unknowingly. And then an increased number of immunocompromised patients. So more patients that are more susceptible to these types of pathogens, we see more of them, we see more chances that, you know, we're going to see more cases of these healthcare associated infections. So here's more a visual of what I was just mentioning. So more drug resistant pathogens are occurring. We're seeing sometimes personnel don't follow healthcare associated, or not healthcare associated, I'm sorry, infection control guidelines properly. And then we see more cases of immunocompromised patients coming into these facilities. So that's why we oftentimes see these healthcare associated infections occurring. So why does that sometimes happen? Sometimes these healthcare staff and personnel may not be able to follow these infection control guidelines because hospitals are overcrowded, sometimes understaffed. So oftentimes, things are kind of done in a hurry, and sometimes, that we kind of miss certain things that need to take place. And indiscriminate use of antimicrobial agents. That's one of the reasons, if you remember, we talked about that in chapter 9. One of the reasons why some bacteria can develop these mutations and kind of learn this drug resistance is because we're oftentimes, just prescribing these antibiotics and antimicrobial medications. And in the event that this is sometimes we're just constantly prescribing these, they can learn these mutations a lot easier and again, develop into these superbugs. And same thing with a false sense of security about antimicrobial agents. We have patients that sometimes will just say, well, I'm on antibiotics, so I'm not contagious. And that's not necessarily the case. Just because you've been on antibiotics for 2 days, you haven't finished your regimen of antibiotics. So therefore you could still be contagious. So that false sense of security sometimes gives patients the thought, and even sometimes healthcare staff gives them the idea that they're fine. Lengthy and more complicated types of surgery, meaning patients are sometimes open on the table longer, making them more vulnerable. Increased use of less highly trained healthcare workers. Again, sometimes shortages of healthcare staff in these overcrowded hospitals. Oftentimes we're just trying to get people in there as quickly as possible, and they're not trained as properly as they should be. Increased use of anti-inflammatory and immunosuppressant agents, just again, weakening patients' immune system, whereas they may need it for those drugs that they're taking at that time. But we're seeing more of those, and again, making them more susceptible to these pathogens. And then the overuse and improper use of indwelling devices. Again, anything that's going to be a little bit more invasive is something we want to make sure we're being very careful with. So what can be done? Strict compliance with infection control guidelines is key. Obviously, I know you guys have heard this many times, hand washing is the single most important thing that we can do to reduce the risk of transmitting these pathogens from one patient to another, or from one anatomic site to another anatomic site in the same patient. So meaning, like, again, the indigenous microflora on a patient's arm, if an alcohol swab is not used before we draw blood from that patient, that needle can inject that indigenous microflora into the bloodstream. And again, the bloodstream is where that indigenous microflora may become an opportunistic pathogen. Or again, in the event we see one patient and we forget to wash our hands, and then we go and see another patient, we have pathogens from the patient A's room, and we now take it to patient B's room. So hand washing is going to be the single most important measure in that circumstance. Other means of reducing the incidence of healthcare associated infections include disinfection and sterilization techniques. So what I was just mentioning with the alcohol on the arm, but also again, washing our hands before that procedure is done is very important as well. Air filtration. We'll talk about air filtration, in a little bit later in this chapter. Use of ultraviolet lights for sterilization purposes. Isolation of especially infectious patients, so that we'll get into that with air filtration as well. And then also wearing gloves, gowns, and masks whenever appropriate. So we'll talk about that too. So again, just more of a visual. This is the number one thing that we can do to make sure that we are protecting our patients and ourselves as well. So let's get into what I mean by a few things with infection control. So infection control itself, these are the numerous different ways that we can make sure that we are preventing infections from occurring in these healthcare settings. So we're going to talk about the term asepsis. I think at this point, a lot of you guys have probably heard the term asepsis, probably in your nursing class. There are two types of asepsis though, and it's key that we know the difference between the two. There's medical asepsis and surgical asepsis. Medical asepsis, as it mentions here, these are precautionary measures that are necessary to prevent the direct transfer of pathogens from one person to another, or even the indirect transfer of pathogens. So through maybe perhaps touching a patient and then touching a doorknob, and then somebody else comes and touches that doorknob. So that's what I mean by that indirect. So through the air or through instruments, like I just mentioned, the doorknob or bedding, equipment, any type of inanimate object. Remember, those are called phone lines. So medical asepsis prevents the spread of pathogens. Where surgical asepsis, this is a more sterile technique. So this is going to make sure that we keep objects and areas completely sterile, which means free of any and all microorganisms, not just pathogens. Medical asepsis is going to make sure that we are ridding the area, whatever it is that we are cleaning, of any pathogens. Surgical means sterile, so all microorganisms, so pathogens and non-pathogens. And well, I'll talk a little bit more about that. So surgical aseptic techniques are practiced in operating rooms, labor and delivery areas, anything that's more invasive. So where a patient is open or, again, more susceptible, we're drawing blood, injecting medications, urinary and cardiac catheterizations, lumbar punctures, any type, again, where something is, like I said, a little bit more invasive, where a patient is going to be open or, again, stuck with a needle, or we're entering something into their urethra, like a catheter. Those are all going to use surgical aseptic techniques, because we want to make sure, because we are going into another part of this person's body, that we're not even taking this good bacteria like indigenous microflora, which is normally fine, but we're not taking it and putting it into a different anatomic site. So again, key differences between medical and surgical asepsis. Medical asepsis is considered more of a clean technique, such as washing our hands, things of that nature. We use medical asepsis when we're changing bedding, bed linens on a patient's bed. That's where we're just making sure everything is clean. Whereas surgical asepsis is more of a sterile technique. So again, as I mentioned, the goal of medical asepsis is to exclude all pathogens, whereas surgical asepsis is all microorganisms. And don't forget, microorganisms include pathogens and non-pathogens. So even the good bacteria that is normally totally fine, doesn't cause any infection, but it could if it makes its way somewhere else. So that goal is to make sure we're ridding the area of all microorganisms. So again, in your more invasive procedures. All right, so continuing with infection control, standard precautions. What are standard precautions? Standard precautions, we're going to go through. I'm going to talk about different measures that we use with standard precautions. What this means is no matter what patient's room we are going into, we are making sure that we are applying what's called standard precautions, meaning that we are making sure that we are cleaning things, that we are washing our hands, that we're cautious of, or conscientious, I should say, of things that we are touching in all patients in all healthcare settings, regardless if there is any type of suspected or confirmed presence of any type of infectious agent. So healthcare settings will provide infection control guidelines regarding these standard precautions. So hand hygiene, gloves, mask, eye protection, gowns, respiratory hygiene, cough etiquette, anything you can think of, safe injection practices, cleaning of patient care equipment, and all of these things, disposal of sharps. These are all things that we'll touch a little bit on today. But a healthcare facility that we work for will typically advise us on these. And especially when there are suspected pathogens present in a certain patient, then there may be even more precautions that we have to take. Standard precautions just means that, we're going into a patient's room. Doesn't matter what that patient has, we're making sure that we're being very cautious with any room that we are entering into. So these are your standard precautions, things that we're making sure we're doing. Hand washing, gloves, gown, and a mask are pretty typical. We're going to talk about where those may need to come in with some suspected pathogens. Equipment, we're taking care of these things, maintaining those clean procedures, making sure everything is kept orderly to make sure that pathogens are not getting into patients' rooms. And then patient placement, depending on what could be present. We'll talk about that. So here's your standard PPE, so your professional protective equipment or your personal protective equipment. So your gloves, gown, and your masks are very standard precautions. But we'll talk about where those come in and why they're especially needed when we have, when we do see pathogens in certain patients, why we need to make sure that we are protecting ourselves with these pieces of equipment. And then this is your procedure for glove removal. I know that you guys learned this in your nursing classes. However, this is a great visual to make sure that it shows you the proper technique for removing of gloves. And again, why this is because you use your gloves to touch patients. And, again, they could have pathogens and whatever it is that you're touching. So you want to make sure when you remove the glove, you're not then touching it with your hands, although you will still wash your hands to be safe. But this makes sure that you're not touching the outside or not taking those pathogens and touching anything else with that glove. So it shows you that proper removal of that. Okay. So those are your standard precautions. So meaning that no matter what, we're always going to be cautious and acknowledge that, we're no matter what the patient is going through or what pathogen they may or may not have, we are, cautious of the transfer of pathogens. But in the event that we have patients that we do know are infected with a infectious disease, we take what's called transmission-based precautions. And this is, similar to your standard precautions where we may be adding a few things to make sure that we are approaching these patients, carefully. So these are used for patients who have known or suspected to be infected with a highly transmissible or epidemiological important pathogens for which additional safety measures need to be taken into account. So beyond these standard precautions. There's 3 types of standard precautions, and we're going to go through each one. Contact, droplet, and then a little bit more severe would be airborne precautions. So let's touch on these. So contact precautions, the biggest thing that I want you guys to be familiar with is what PPE we need to keep in mind when we have these certain types of transmission-based precautions. In contact precautions, this means that a patient has a pathogen that can be transferred through either direct or indirect contact. So meaning that we need to make sure that we are protecting, number one, our hands. We need to make sure that because through contact with this patient, if we do have to touch them, we could become vulnerable. And then whatever we then go touch after becomes vulnerable to this particular pathogen. So the number one PPE that needs to be worn in this event are gloves and a gown. We need to protect anything that the patient could touch. So that's the idea here is this particular disease that this person has is transferred that way. So it's not anything in the air, so I don't have to worry too much about, what's happening in the atmosphere around me. It's just really through touch. So we need to protect everything that could be touched or that we are going to touch. So gloves and a gown. So that's the big thing I want you to focus on. And that's how that would be asked on a quiz. If I said, what PPE needs to be worn in the event that we have contact precautions, this is what we're looking for, gloves and a gown. Okay. This goes through a huge list of different diseases that would require contact precautions. I'm not going to ask you these. I always leave this on the slide though, because I do think it's interesting to go through and see what would be an example of something that requires contact precautions. Chickenpox is a great example, although I know a lot of you guys probably haven't experienced chickenpox, but it was something that is transferred from person to person through touching each other. So that's one that you may have heard of. Acute viral conjunctivitis, which is pink eye. So that can happen through touching, mainly through touching the infected eye and then maybe touching another individual. So those are, just a couple examples of contact precaution. Like I said, I won't ask anything about the examples here, but just it's here for your reference if you want to use it. Again, main thing to focus on is the PPE that is required with a patient that has contact precautions, gloves and a gown. When a patient has droplet precautions, this means that a patient may be able to transfer their particular pathogen through droplets. So in the event that they sneeze or cough, that could then easily make its way to my body, and we need to make sure that we're not ingesting or inhaling those. So that's where a surgical mask needs to be added. So COVID-19 is a great example. This is something that has, is going to be a droplet-based precaution. So that's why we're making sure that when we're around other individuals, we are not only protecting our contact, our gloves and our gown is worn, but also a mask. So gloves, gown, and surgical mask is required in droplet precautions. So another big thing to remember there, just the PPE, gloves, gown, and a mask with droplet precautions. Again, here's another list that goes through things that are going to require droplet precautions. Like I said, you do not have to know this list, but a great example would be like influenza. Influenza, typically patients are coughing and sneezing and can easily transmit through the flu. They can easily transmit that pathogen that way. Okay. And lastly, then there's airborne precautions. Airborne precautions here, this is going to be a little bit more severe because this just means that all the patient has to do in order for them to transmit their pathogen from one person to another is breathe. Obviously, they're going to do that. So this means when we walk into this room, one, we're going to talk about patient isolation. This particular individual is going to have a private room with a certain type of air filtration, and we'll get into that in the next couple slides. But right now, we're just discussing the PPE that's required. Here, a surgical mask is not going to be enough because air still has its way or has a way to get in through the openings that occur with a surgical mask. So here we are going to add what's called an N95 respirator, or sometimes called a duct respirator. So that's something that we need to add with airborne precaution. So we're still going to use our gloves and a gown as standard. That is our standard precaution, always wearing those. But here in an airborne situation, duct respirator, or again, like I said, an N95 respirator. So here's some examples of some airborne precautions, but let me show you what that N95 respirator looks like. You can see this provides a seal around all of the edges around her mouth. And that means that air can't make its way into this person's nose or mouth. And this particular mask has a great filtration system, so you can still breathe, but pathogens are not going to make its way through that mask. So that's what I want you guys to be familiar with these, excuse me, transmission-based precautions. For contact, gloves and a gown, number one. Droplet precautions, we need to add the surgical mask to the gloves and the gown. For airborne precautions, we're changing that surgical mask to the N95 mask. Okay, let's talk about isolation. As again, an airborne infected patient, all they have to do is breathe. So chances are when you walk into their room is filled with their pathogens. So meaning that you are incredibly vulnerable to this infection. But hospital settings do have what's called airborne infection isolation rooms, or AIIR. In these situations where we have a patient that has this incredibly infectious disease, place them in this room. It allows that, it allows it to where we can make sure that pathogens are not spread as easily. In an airborne isolation room, the room is under what's called negative pressure. As you can see here, the way the air is going to flow is going to flow from outside in the hallway. It's going to enter into the patient's room so that air flows in that direction instead of flowing out, so that pathogens that are, again, filled in this patient's room are not going to flow out into the hallway when we open that patient's door. A lot of healthcare settings have kind of a double door system to where there's a pressure change when you walk into the first door and then the second door. So making sure that happens kind of provides kind of a double barrier there. But that's what that is. So remember that an AIIR, or an airborne infection isolation room, is under negative pressure, meaning air flows into the room instead of out. And then the way that air flows out of the room is going to be through a filter so that it continues on to other rooms in the hospital. They're filtered so that pathogens are not going to be in that air exiting this room this way. So air is evacuated from an AIIR. From that AIIR is going to pass through a HEPA filter, which is, again, filtered to make sure that it doesn't contain those pathogens. Okay. In the opposite event, so maybe we have a patient who is incredibly vulnerable to a pathogen, meaning that they're not sick with this pathogen, but perhaps they're going through chemotherapy or a burn victim. Oftentimes they're incredibly vulnerable to these pathogens, so we put them in the total opposite type of room. These are what's called protective environments. So patients who are, again, especially vulnerable to infections are placed in these protective environments. Here we're going to see positive pressure, where we see the same types of filters, but instead air is flowing through the filter into the room. So even though they've already passed through filters, in different rooms throughout the hospital, here we're going to see another one. So making sure that there's no pathogens entering into this patient's room. And the same thing goes when the door opens. We don't want any pathogens that could potentially be in the hallway to make their way into the patient's room. So instead, when the door opens, air flows out into the hallway, making sure that that doesn't happen. So in this case, we're really trying to make sure no pathogens enter into the patient's room. So in this event, they are under what's called positive pressure. So the AIIR was negative pressure, keeping all the pathogens contained in that room. And the protective environments are under positive pressure, keeping all pathogens out of that room. So that's the difference between our different protective environments that we can put patients into. So some other ways that we can make sure that we are preventing the spread of infection throughout these healthcare settings, we need to make sure we handle food and eating utensils properly. So some of the regulations for safe handling of food and eating utensils would include, one, making sure we're using high quality fresh food, nothing that's been sitting out for a while or something that's expired. Properly refrigerating and storing, properly washing, prepping, and cooking the food, properly disposing of anything that's uneaten, making sure that we're covering hair and wearing clean clothes and aprons, thoroughly washing our hands and nails before handling food, but also after, so that, again, anything that could be in the food is not making its way elsewhere. Keeping all cutting boards and other surfaces scrupulously clean, and then washing, cooking, and eating utensils in a dishwasher with a water temperature that goes above 80 degrees Celsius. So making sure that it's at that really high temperature, make sure that it's going to kill any pathogens. Washing food or washing utensils just in a sink with hot water, no matter how hot that water can get, it's not going to be hot enough to kill those germs. Instead, putting it in a dishwasher, dishwashers typically get to really, really higher temperatures. And that's going to make sure that that helps to sterilize those utensils. Handling of fomites. So again, fomites would be all inanimate objects. In a hospital setting, we know that that's going to be bedding, any type of equipment that's used. So fomites, again, are these non-living inanimate objects other than food that may harbor and transmit these microbes. So patients' gowns, beddings, towels, equipment, telephone, keyboard, what have you, anything that is in the room. So transmission of pathogens by fomites can be prevented by making sure we're observing certain rules. Use disposable equipment and supplies whenever possible. Anything that can just be used and then thrown away after we use that with a patient is going to be ideal. If it is something that does have to be used again, we want to make sure that we disinfect or sterilize that equipment very soon after use, so that we make sure that those pathogens are no longer on that equipment. We use individual equipment for each patient. Use disposable thermometer or thermometer covers when possible. Waste disposal. So I'm sure you guys are familiar with sharps containers. We can't just throw sharps in a trash bag, because then anybody who comes and takes out the trash could be stuck with these needles, and we definitely don't want that to happen. So we make sure we follow any OSHA standards for disposal of any waste, any type of medical waste, like any of the not drug samples, but clinical specimens. When we're taking blood samples, urine samples, fecal samples, this is all stuff that we will talk about in next week's lesson. But they need to be disposed of properly, because they are medical waste. But also the same thing with sharps. As I just mentioned, that we can't just throw those away in the trash can. There are sharps containers. So sharps should be handled and disposed of properly, and make sure that we use the designated puncture resistant sharp containers. So what happens in a healthcare setting or a hospital? Typically, these healthcare facilities have some type of formal infection control program in place. They usually have some type of committee, an infection control committee, that is composed of a representative or two from most of the hospital's departments. So that includes not just the nursing department that I know that I'm talking to nurses right now, but medical and surgical services, pathology, so also nursing, hospital administration, risk management, even the pharmacy, housekeeping, food services, central supply, janitorial staff, all of these individuals that work in a hospital, all of them need to work together to make sure that they know how what they do, what they're working in and what department they're working in, how they can prevent the transmission of pathogens. Typically, the chairperson is usually an infection control professional, such as an epidemiologist or an infectious disease specialist, an infection control nurse, or some type of microbiologist. Somebody that specializes in infectious disease so that they can help to work with all these departments collectively to make sure that this is controlled. So again, the laboratory, the CML, is the clinical microbial laboratory. The CML participate in infection control by monitoring the types and numbers of pathogens that are isolated from hospital patients. So they know what diseases are in the hospital at what time, and what, again, is pretty normal. As we talked about with epidemiology in the last chapter, epidemiologists are constantly looking at certain geographical areas. Here we're talking about just the hospital, and they know what's pretty normal this time of year. We typically see an influx of the flu at this time or something of that nature. But when we see a whole lot more, or when we see maybe a new disease that is not normal at this time, this is where we need to notify the appropriate infection control person should maybe an unusual pathogen or maybe an unusual high number of isolates if a common pathogen be detected. So like I say, maybe we're seeing more of an outbreak here, what we're not used to seeing. Maybe we're used to seeing that pathogen, but we're seeing a whole lot more of them. Or again, maybe we're seeing a pathogen that we don't see very often. This is where we need to start notifying somebody. The CML also processes any environmental samples, including samples from hospital employees that have been collected within these affected wards. So HAIs can add several weeks to a person's hospital stay, may lead to serious complications and even death. Insurance companies are rarely going to reimburse healthcare facilities for the costs associated with HAIs because of the fact that really it was up to the hospital or this healthcare setting, or I'm sorry, facility, to maintain this. That really, so healthcare companies kind of see it as it's their fault that this patient received this pathogen in your care, so we're not going to cover that. So this can be pretty costly to the hospital. So HIIs can be avoided through proper education, disciplined compliance with infection control practices. Remember, all healthcare workers must fully comprehend the problem of these healthcare associated infections, must be completely knowledgeable about infection control practices, and must personally do everything in their power to prevent them from occurring. All right, guys. So that is chapter 12. So again, the idea is to make sure that we're trying to prevent in any way possible the spread of any pathogens from one person to another. And that's how healthcare facilities are going to try to control that as best as possible. As usual, guys, if you all have any questions at all, you just let me know.